Hi, welcome back to the Birthlink podcast. I am so excited today to speak with Rachael Cappuccino. She is a physical therapist in my neck of the woods. She lives over in Thousand Oaks area. If you don't know that area, like Ventura County, I live in Simi Valley and just neighbors, practically neighbors, 20 minutes away. I found her on Facebook groups where, birth workers and moms and business owners all hang out. And if you are not taking advantage of that, I hope you are. It's so good to have a little community and grow who you know. And because who you know and who you have around you kind of makes who you are, right? So if you are pregnant and you want to give birth in an empowering, confident way, then you surround yourself and your media and your education around that as the goal, right? That's why we're here. There's this episode, this interview actually with Rachael, I did like a couple months back actually, and this is a good time to bring it out. I did two physical therapists. I know a lot of physical therapists, you guys, over the years. It's crazy over this last year how many I have met, and then the few that a resounding few that share my message, I just clicked with. And two of them I invited on the podcast, and I didn't want to put them back to back or anything. So unfortunately, we had to spread them apart, but it's Rachael's turn and she's up now. And, I was just listening to it and it brought me back to just like, I was using a different software and I didn't know I was supposed to wear headphones. And it was just funny reading back. And honestly, it's only a couple months. It's crazy how much you can learn in 2 months and a few episodes and a few interviews. And it just kind of made me think what it's like for us giving birth, like how much we don't know, we don't know is out there. Right? It's crazy. I'm learning something new every day, I tell you guys. And just in a few months, how much you can learn about your body and about your health and the healthcare system and how to make sure you get the care that you want and deserve. You can learn that in just a few months. I promise you. I have the crash course available now if you want it. But if you want to be a client with me, that's what we're gonna figure out, right? All these things that you don't know, I'm going to share with you all the information I have and coach you through how to be a leader and communicate in this crazy hospital system that we have. So I appreciated listening back to this episode, and I hope you enjoy listening to this episode. Let's dive in with Rachael and learn something new every day, right? Let's learn. You're going to hear me say this a lot during this episode because there's so much. I was like, I didn't know that. At least I didn't know that before this year. And if I didn't know it, it's most likely you're going to learn something new today. So let's dive in. Okay. Welcome to the Birthlink podcast, presented by My Friend's a Nurse. I'm your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of two beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Hey, Rachael. I'm so happy to have you here on the podcast, the Birthlink podcast. Out now, I think this is we've already got like 4 or 5 episodes in the bank. So thank you for coming on. Just a brief introduction about Rachael. She started Cappuccino Physical Therapy after the birth of her 2 children because she believes that an active lifestyle does not end with motherhood. Having experienced both a vaginal delivery and C-section herself, she understands that physical challenges that come with pregnancy and recovering from birth. Too many women accept these challenges as their new reality, and she firmly believes that most can be treated with pelvic floor physical therapy. So she is a pelvic floor physical therapist with her own business here near me. She's in Thousand Oaks, and I live in Simi Valley. And we connected on a Facebook page all about birth workers and just moms of Conejo Valley. And we love that support system that the women bring. And I was able to meet her. She's an advocate for women's health and them managing their health care, and then also pushing the spectrum of our access to this health care when we're discussing it with doctors and educators and nurses in hospitals, which I really want to dive in with her. So welcome first, Rachel, to the Birth Link. How are you? Tell us.
Thank you. Thanks for having me. I'm excited to be here and talk
Me
today.
too. Me too. So let's jump in. I gave a little background, some information. You can visit your website to get more, but tell me more about how you went about starting your business and specifically focusing on the pelvic floor.
Yeah, absolutely. So I have been a physical therapist for 10 years now. I graduated school 10 years ago. And then about 6 years ago in 2018, I decided, or I was thinking, I'm going to start having kids soon. There's not a lot of pelvic floor physical therapists in the area. I'm probably going to be meeting moms who are going to be having issues. This would be an interesting niche market to go into, especially if I wanted to start my own business, because there are a ton of orthopedic clinics in the area. This area is just saturated with orthopedic. I was like, you know what? I'm just going to go out on my own, do my own thing to really specialize in pelvic floor and be able to have the flexibility of a schedule to spend time with my kids as well. So that's how I started my business.
Love it. Oh, it's quite a leap to take that initiative and start your own business. And
Yes.
when you have a passion for it and you can spot the problem so clearly, then you can help figure out the answers and
Yes.
reach out to more experts and then share your knowledge with them.
Absolutely.
Beautiful. I love that. So I want to ask, while you're starting this, especially working with women with pelvic floor issues during pregnancy and postpartum, what would you find is your biggest struggle, like yourself being able to share this information?
It's just hard. A lot of people always say, like, I didn't know pelvic floor physical therapy was a thing. And I'm like, it is 2024. How do people still not know pelvic floor physical therapy is a thing? Especially if they deliver with like OBGYNs or I'm like, these people know that it's a thing. The OBs know that it's a thing because all of us pelvic PTs are marketing to anyone and everyone we know that works in the perinatal space. So that is super frustrating. And then the other thing is people telling me, I wish I had known about this sooner. Like we get people coming to us. I have someone right now who's like 4 years post C-section with scar pain. And she was like, why didn't anybody tell me about this sooner? She's feeling a lot better. She's like, I wish I had known about this 4 years ago. And I'm like, I don't know. So really just trying to spread the word. Pelvic floor physical therapy is a thing. Every pregnant woman and every postpartum woman should be prescribed pelvic floor PT automatically. So that I would say is probably the biggest struggle is just I wish more people knew about it.
Yeah, yeah. I'll tell you right now, I'm went through nursing school. I worked in a medical practice for 3 years, and, I went straight into labor and delivery for the last 8 years, and I did not know that this existed through the
It's
whole
that's
thing.
wild. Yeah,
School, no. I mean, we
right,
hear about physical therapy, but I never considered like pelvic floor is a specialty or that we're addressing women's issues. And
right,
mind you, I myself have dealt with issues since 20 years old,
right,
from sciatic pain to, and
right,
this is right after birth, severe sciatica after birth and
right,
delivery, with a vaginal delivery, and, you know, urgency. I
mhm,
can't laugh or jump anymore really
right,
without peeing a little and all of this stuff. And
right.
when I talk to my doctors, which, it's a little embarrassing. You're just like, do I
Of
want to
course.
mention this?
Yeah.
But the couple of times I did over those, 20 years, I was told it was normal. And then you
Oh,
hear whatever you hear about it, it's like jokes, like, oh, well, you're a
right.
mom now. You got to wear
You're
Depends and da da da, with
not
zero
normal.
solutions. Yeah, and I'm like, okay, great. And
Yeah.
the little I did at the gym, like weightlifting and stuff, and that just really started like last 2 years. I saw some improvement in it. I'm like, "Oh, okay, so I just need to build strength down there and all
Yep.
that," but still zero knowledge. It
Yeah.
wasn't until September that I started working with Greg Todd. He is a physical therapist that
Mm.
works with other physical therapists to become entrepreneurs. I was in the healthcare space. I wasn't a physical therapist, but I said, "Hey, I love your message. I love how he speaks. Let me start working with him to build my own brand and business, like get me off the couch,
Right.
basically. He was able to do that. And it
Cool.
wasn't until I got into that group that I saw all these physical therapists, and then there were physical therapists specialized in pelvic floor, and they
Yep.
had such a voice. I started following them on Instagram. I started talking to them. I met you. I met quite a few. So
Yep.
you'll see, you guys, listen, if you're listening, you will get a few pelvic floor therapists on my show, 100,000%,
Yes.
because it's so important and I need everyone to know about it because I did not know. Your doctor may not tell you, your nurse may not
No,
tell you. You
yeah.
just don't know.
It's so important, and you have to advocate for yourself, so just know that it is a thing. It is never normal to pee your pants. It's not normal to have C-section scar pain. There's a lot you can do pelvic floor PT-wise to prepare for labor and delivery, so there is help. You don't have to live with these symptoms.
Yeah, yeah. And then what goes along with not knowing about it is the struggle of just getting access to it. Okay, one, you don't know about it, so no one's really referring you
Right.
over there. And then it's like that conception or misconception, possibly, or maybe some truth to it that you're like, okay, I know it exists now, but I'm gonna have to pay an arm and a leg for it. Like, is it even covered? Is it Can you discuss a little bit of that? Like once you know, you've listened to the show, you know this exists, you can fix your pelvic floor and you can even start before you get pregnant or during pregnancy. It's no I started 20 years later after my baby and
That's
been
okay.
getting great results. So that's okay
Amazing.
too. But
Yeah.
then what it would be the process? Okay, I want to get a physical therapist pelvic floor. How do I go about it?
So in the state of California, we have something called direct access where you don't need a prescription for physical therapy, especially if you have a PPO insurance. So you can just go straight to a pelvic floor PT, which is awesome. And then most pelvic PTs in this area, all the ones that I know and myself included, were out of network with insurance, but we provide super bills. And we do that because we don't want insurance dictating your plan of care. Because a lot of times insurance will be like, 5 visits. I'm like, 5 visits, really? After major abdominal surgery, which takes about a year to heal. I'm just like, are you kidding me? So that is the nice thing about being out of network is like we can break down those insurance barriers and you and me, the patient and the therapist get to decide what is best, not some random person in Iowa who is reading your chart and has never met you before and doesn't know how your C-section scar pain is affecting your life. So I could go on for hours about this, but I won't.
Yeah. No,
Yeah.
it's I'm sure really frustrating.
It's so frustrating, and we get, like, reimbursement denials, like, "This is not medically necessary." I'm like, "Are you kidding me? Like, are you
Yeah,
kidding me? It's medically necessary." So,
I know. But they go along with that perception of it's
yeah.
normal. This is
Yeah, well, and it's, like, in your insurance company's best interest to deny you so that they get to keep the money, and I'm just like, you have to fight for it. I mean, we have a lot of patients that get reimbursed, but they have to fight for it, which is nice that they get it, but, like, it should just be standard of care.
I know.
I spoke to somebody who is from Belgium, and she said that in Belgium they get 40 visits of pelvic PT after birth. I was like, "What? Are you
What?
kidding me?" That's amazing. So
That's
we can do
crazy.
much better. Yeah.
That's crazy. That's like
Yeah.
a year's worth, maybe.
Yeah,
If
it
you go
really
every
is.
week, 2 years.
Yes.
Oh
Yeah.
my God. And I bet no one's peeing in their pants over there.
Probably not. That's a great question.
We have to find out. Okay, so let's talk a little bit about so you guys just bring it up with your doctor, see if they can do a referral, talk to your insurance, but don't feel limited by it. You can
Yeah.
find out
Don't call.
yeah, what your state or country has to offer you. I think knowledge is power though, just knowing it's out there. And then you
Yes.
just do a little homework to find out how you can access it yourself and pay the least amount. Because
Right.
honestly, we shouldn't have to pay an arm and a leg
Right.
just so that we can walk properly, right?
Totally.
So let's see. You deal with a lot of women before birth, after birth, during birth. What can you give me? Can we touch on like maybe two or three of the most common complaints that you get from women that they need help with, and that especially if it was preventable, like maybe we can
Yeah.
discuss a little bit.
Yeah, so I'll start with pregnancy. In pregnancy, we see the common pregnancy related aches and pains. So, like tailbone pain, pain in your back, pubic bone pain, pain in the front, leaking, peeing your pants with coughing, sneezing, running, jumping, all that kind of stuff. And then we also do birth preparation, which is really cool because we teach you how to relax the pelvic floor muscles and we teach you how to push correctly so that it reduces your risk of pelvic floor injury during delivery, which sets you up for success postpartum. Because then postpartum, what we commonly see is again leaking, pelvic organ prolapse, which is when your pelvic organs start to descend out of your vaginal canal, which that's not fun. Diastasis recti, which is the abdominal separation. C-section scar pain is a very common one. So just because you had a C-section does not mean that you don't need pelvic floor PT, because you do. I would almost argue it's even more important. It's definitely equally as important. And what else do we see? Pain with sex is another really common one, especially postpartum, especially if you are breastfeeding, because your hormones are changing and they're different. So those, it's just kind of in a nutshell, some of the general things that we see.
Yeah, and a lot of it's preventable just by
Yes.
going to get help. So
Coming.
what would you
Yes.
say, like, from the women that actually get to come in and know that they have the ability to like set themselves up to prep or practice with you before
Yeah.
they start pushing? They learn how their muscles and their breath work with their
Mm-hmm.
core and their how to relax their pelvis and get a step-by-step
Yes.
instruction. So I'm guessing you can tell me that those women have a higher success rate of pushing
Yep.
their baby out and lower
Yes.
pushing. Is that right?
Yeah, totally. So I would say I haven't started collecting statistics yet, but that's something that I definitely want to do. But on average, I would say our first time moms push for about 30 minutes and they have minimal tearing, like maybe a grade 1, maybe a grade 2, and some have no tearing. It just kind of depends. And then our second time moms usually have no tearing. So it's
Shut
really,
up. That
yeah.
is
So you
so
have to like
cool.
be proactive about it. You do not have to, pelvic floor PT doesn't have to be reactive. It can be proactive. Get the
Yes.
help first, because then you're setting yourself up for success postpartum, which is awesome.
If I this is like I don't how long I'm gonna push, and I'm pushing with
Right.
women in the hospital for 2, 3, 4 hours.
Horrible.
Like, it's exhausting for everybody. I can only
Yeah.
imagine for the mom and the baby.
Yeah.
And then it ends up they're just too tired, or there's just not enough
Right.
strength, or just doing it wrong in a way that
Right.
I can't even assess. Like, in my book,
Right.
they're hitting all the marks, but there's something else they're not getting in their
Right.
head, or they're too in their head. And this, yes, they
Right.
will end up in a C-section, laboring
Yeah.
for all that time, then pushing
Right.
for all that time just to end up in a C-section.
Yeah. Frustrating.
And because they just need to get it over with. I can't tell you how many
Yeah.
times that has happened. I
Oh,
think in
really?
the last year, especially with my education, it's been happening less and less because I can prep
Oh, that's
mom
good.
earlier. Yeah, I
Yeah.
know. I know more of what to assess, and it's the help from all my PT friends. I
Yes.
swear.
Amazing. I love that. And I love that
Yeah.
you are being proactive, because I'm obviously not in the delivery room, but it comes down to the people in the delivery room, or whether you're in the hospital, whether you're with a midwife, whoever, that's where it's going to be most important. And you want the baby to come out slowly and like have that gradual pressure on the perineum so that it doesn't tear and all those things. And we coordinate it with your breath, and breathing is better than not breathing. And so because I know a lot of people tell me, oh, the nurses made me hold my breath. And I'm like, why? Breathing evidence shows that breathing is better. So I love nurses who are doing this and being proactive
And
about
we
it
have to be
too.
proactive because they don't teach us this.
Right.
On
Right.
all my years, nobody has told me anything. I have had to open my eyes and
Yep.
go outside of the hospital system to
Yep.
just learn all these alternate techniques and then I
Right.
find out the stuff they're teaching me isn't exactly evidence based, or it's just old
Nope.
school and there's no method to the
Right.
madness. I'm like, what have I been doing? And that's part
It's
of
hard.
growth. That's part of figuring
Yeah.
things out, and most of the time the moms that I deliver with are just like, why didn't I meet you months ago, right?
Yeah.
Which is the whole
Yep.
reason I started
Totally.
my friend's a nurse, to meet them months before. But then
I
also
love
I
that.
was like now you have the opportunity, if you're pregnant, to find a pelvic floor therapist, get
Yep.
your pelvis assessed. If a
Yes.
doctor tells you your baby's too big, and then you go in. So there's an assessment for that, right? So your
Right.
pelvis is too small, your hips are too narrow, your baby's too big, and they only did one vaginal exam.
Right.
And not incorporating what happens to your body during labor, but also
Right.
it's not a proper assessment. So you guys,
No.
I hear you guys do the full pelvis assessment to come up with that diagnosis, right? Maybe ultrasound from the doctor.
We don't do like ultrasound stuff. We do so from my perspective, I am doing an internal exam to check your pelvic floor to see if your muscles are relaxing. I can't exactly assess like the size and the shape of your pelvis and to like, like some people are like, oh, your hips are too narrow. I
Mm-hmm.
don't do that. But for me, it's, are your pelvic floor muscles relaxing so that they can get out of the way? And then
Uh-huh.
it's also educating on the different positions and movements that you can do for the first and second stages of labor to optimize your hip mobility. So we're really more so like optimizing mobility and not
Yes.
so much like size, if that makes sense. But we range of motion.
And an understanding that the pelvis changes with different positions.
Right.
And
Right.
if you
Exactly.
can correlate the how you put your body in that position for where the baby's at
Right.
in your birth canal, it's
Yep.
going to give just, you're just like, it's like fitting a large desk through a doorway, and you're like, okay, that's not going this way, so maybe we move it this way, and then you can help adjust your body to that. And you need a lot of, you're not going to get it like the first time. Like,
No, you
could
need
tell
repetition.
you these are the positions to do, and you're like, okay, got it. And then you need multiple different people, so a great birth class, a nurse coach like myself, a
Right.
pelvic floor therapist that
Right.
specializes in these positions, watching videos,
Yes.
going to YouTube, like just get
Yep.
it embedded in your head. And then when you get to the hospital, you can talk to your nurse. Like, are you familiar with the different positions, the
Right.
Levant circuit or the Miles circuit or whatever we can do for different
Right.
stages? Are you familiar with that? If she says no, which is rare, we are
Right.
trained in this. But if she does say no, you can request a new nurse. That can I get
Yep.
someone, because this is really really important to me. Can I get someone that really understands this? And they're going to go pick the nurse that probably won't shut up about it, like me. Right?
Yes. Love that.
They have go-to nurses. Or she would just be like, hey, we don't have, we I can be your nurse, but I'm learning all of these things. And maybe I have had nurses come out and be like, hey, you're good at, position changes, can you help me? And I will go in,
Right.
talk to the patient about it, and help your nurse adjust you. So it's
Yeah.
about building that support system around you. But if she's letting you lay there for 2 hours in one position,
No.
no, you ask,
Yeah.
hey, I don't want to do, I need to change, I'm in labor, unless you're like zonked out and you need to sleep.
Right. And you're asleep. Yeah. That's
Yeah, but
different.
if you're awake and you're just laying there with in one position, maybe she put a peanut
Right.
ball in and she thinks her job is done.
No.
No. You gotta be
You gotta
moving
move.
every 30 minutes, every 15 minutes while you're pushing.
Yes.
Legit. Right?
Always moving. And then that's also beneficial to have a doula too. So we're big proponents of
Big
doulas
proponents here in Conejo Valley.
because
We love our doulas.
yes, they are incredible. They are a wealth of knowledge too. So if you have a really good labor and delivery nurse and a really good birth doula, hopefully a really good provider, OB, midwife, whoever,
Yeah.
you should be setting yourself up for success.
Yeah, and
Yeah.
please don't just like hope for it.
Right.
And like
Right.
I hope it all works out.
Right.
You
But
really
yeah,
do
you
have
got
to
to
be
put the work in
proactive.
though.
Yeah, yeah.
Yeah.
So I'm glad we're in a PT therapist that can work with you specifically and make it very individualized.
Yes. Very individualized according to your body.
Perfect. Well, let's leave on maybe a proactive or golden tip that you could leave our listeners that they can take away and just keep in their mind. Do you have anything, a general
Yeah.
amazing tip you can leave us?
Yeah, well, so definitely advocate for yourself. That's the number one thing because most people are not going to advocate for you. And if you are pregnant, whatever it is that you're going to do something to prepare for birth, whether it's take a childbirth education class, whether it's see a pelvic floor PT, whether it's get a doula. It's just the more you know, the more educated you are. That is just so helpful going into birth. And I think the evidence shows that it's helps improve birth outcomes. So I highly recommend that. And then postpartum, just know that it's never too late. So it doesn't matter if your kid is 6 months old, if your kid is 6 years old, 16 years old, there is help. You just kind of have to go seek it yourself. I wish it wasn't that way, but advocate for yourself and go get the help that you need.
Awesome. Thank you. Thank you. Thank you. Thank you so much, Rachel. It was good seeing you
Of
again
course.
because
You too. That was so fun. Thanks for having me.
yeah, we'll get together soon, I'm sure. And
Sounds good.
I'm doing the birth, what is it called? Baby and birth fair.
Oh, the resource fair. I
Are
think I'm
you
gonna be
doing
out of
that?
town that weekend, so I will
The
not.
third.
Yeah, I'm trying to enjoy my summer with my kids and not
Good
overschedule
for
myself.
you.
So,
As we
yeah,
should.
that was
Yeah.
that was my goal for this summer, is to not overbook. So I probably won't be there, but I'm sure I will see you around soon.
Yes, and if anyone's in LA area or Simi Valley or any Conejo Valley, come to the baby and birth fair,
Yes,
and I'll post it on my website, and then I'll see you there. But Rachel, it was awesome. Thank you so much.
of course. Thanks for having me. Well, that's a wrap on this week's episode. Thank you so much for listening in. I hope you enjoyed it as much as we enjoyed having it. And I am looking forward to next week. So don't miss as I continue on with the first 15 series and diving into placenta encapsulation. What are you going to do with the darn thing once you deliver it? Are you going to toss it in the incinerator at the hospital or in the trash? Or are you going to take it home? And I don't know what else. Let's find out next week what your options are, what the history is, so you can make the decision before you ever get to the hospital. All right, we'll see you next time. Bye.
Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.